Good evening, and thank you for joining us today on Webinar Wednesday. Tonight, we're talking about the latest in MS research and news. This webinar series is brought to you by CanDo MS. My name is Kate Togneri, and I'm a programs manager at CanDo MS. I'll be your moderator this evening. First, I want to thank our generous sponsors for supporting this year's webinar series. Thank you to Genentech, Viatris, and EMD Serrano for their support. So now, please join me in welcoming our speakers. We have Dr. Jenny Feng, neuroimmunologist at Ochsner in New Orleans. Welcome, Jenny. And Dr. Stephanie Buxhoveden, Chief Scientific Officer at the Accelerated Cure Project. Welcome, Stephanie, and thank you both for being here. I'm going to hand it off to you, Stephanie, and thank you both.
Thank you.
Thanks, Kate. Welcome. I'm so excited to be talking about research, and I can't believe we're already here at the end of 2024. So we're going to spend the evening together talking about some of the most exciting things that have gone on in research this year. This includes a huge development in new diagnostic criteria. We're going to talk about what's new in managing symptoms and exercise, in diet, in biomarkers, in underserved populations. So please drop your questions in the chat. Feel free to exchange information with one another as we go through these slides. I often say the chat, people leave getting more out of that than they do out of us. So thank you in advance. So first of all, let's talk about this new diagnostic criteria. So this just rolled out late in the year at a conference called ECTRIMS, which is the European conference every year. And this is something that is so important for so many reasons. It's hard to diagnose MS, and notoriously in the past, it has taken too much time to get to a diagnosis, which means treatment is delayed. So the whole goal of this new diagnostic criteria is to get the diagnosis earlier and more accurately. So in addition to being hard to diagnose MS, it's also easy to confuse it with other conditions. There are over 100 other diseases that mimic MS, but we've come up with some new MRI biomarkers that really help distinguish MS from those other, what we call mimickers. So this is an MRI of the brain here on the slide, and you can see the red arrow is pointing to something called a central vein. What we found in MS is that most of the lesions in our brain and our spinal cord occur around a blood vessel, which makes sense because those immune cells are traveling through the blood-brain barrier from a blood vessel into the CNS, where they immediately start attacking. So it makes sense that a blood vessel's sort of in the middle and then all the damage is radiating from there. Well, this turns out to be pretty highly specific for MS. So you can do this on pretty much any MRI machine and take a look and see if lesions have a central vein running through them. Another new MRI biomarker is what we call a paramagnetic rim or an iron rim that happens over these lesions. And that's an area of like smoldering inflammation that's ongoing. And that has been associated with more severe MS and worse prognosis. Another important criteria difference is that we can now count the optic nerve as its own space in the CNS, and you have to be able to establish that MS has attacked two different places in the CNS before one can be diagnosed and start treatment. So now having the optic nerve is really important because number one, the most common presentation of MS is optic neuritis. So having the optic nerve count as its own thing, you have an optic nerve lesion, you have a brain lesion, or an optic nerve and down in the spine. Now you've met that criteria for dissemination in space, and boom, we can get you on medication faster. We also have a new CSF biomarker, KFLC, and that's just an alternative to oligoclonal bands, which are notoriously difficult to measure in certain labs. And so now you have both available, which is just more flexibility, could be faster and easier to measure just depending on what lab. So the whole goal, again, we diagnose early and we diagnose more accurately and we get people on treatment. So we also have a great deal happening in emerging disease-modifying therapies. I'm not sure I mentioned this, but I myself live with MS. And I remember when I was diagnosed, we had a handful of options. And just to see this slide of what's happening in disease-modifying therapy in the span of 1 year is just absolutely incredible. So we have some new approvals, some new FDA-approved medications, including a subcutaneous or a self-injected right under the skin, a subcutaneous Ocrevus. So you can administer this once a month at home if for some reason getting IV Ocrevus is not a great option for you. We also have our first biosimilar treatment. So it was a biosimilar to Tysabri. This is very common in cancer and other diseases. Biosimilars are pretty common, but this is the first one we've had in MS. And basically the goal is to enhance access and hopefully make it less expensive. So we saw the first one hit the market in MS this year. Very exciting. We also have some emerging therapies that are sort of like in different places of the life cycle. So up on top, we have BTK inhibitors. This is going to be the next class of disease-modifying therapies in MS. So we anticipate there are several in the pipeline. The one that has been talked about the most at conferences is tolebrutinib. And this was shown to slow disease progression in secondary progressive MS, which is great, despite having actually no relapse rate advantage over Aubagio in relapsing remitting MS. So it's interesting where we're actually seeing some slowing of this more progressive phase and maybe not as much impact on relapses. So everybody's really excited and paying close attention to these BTKIs, especially in SPMS, and there are some primary progressive trials going on as well, and those are in the later phases of drug development. Whereas CAR T therapy, so this is a new and emerging treatment where basically you have your cells taken out and then you get chemotherapy to wipe your immune system out and you get transplanted CAR T cells and they target and eliminate autoreactive immune cells. So this is in very early phases, phase 1, just measuring efficacy and safety, but seems to be a promising new class of therapeutics in MS. And then I put a couple of experimental things here. So PIPE 307 and ESI1 inhibitors. These are remyelinating treatments with really promising animal study data. So we haven't gone into humans with this, but the animal study data is looking really good. So we're going to keep following that closely. There was a big trial funded by the National MS Society evaluating whether simvastatin, which is a really common cholesterol medication, whether simvastatin had a benefit in MS, because we saw some promising data that it could possibly, but it was found to be ineffective in a recent study. So we tested it, we tried it, and unfortunately, it didn't seem to have much of an effect. So we have a bunch of new symptom management research going on too. Cognitive rehabilitation. So they looked at remote cognitive rehab, which is really important because not many people have access to really great cognitive rehab, especially for in the MS population. So they found that 6 sessions online did significantly help cognitive symptoms. And then there was another study which combined cognitive training and aerobic exercise, which actually increased brain volume. I'm going to take a second and emphasize that it increased brain volume in areas tied to memory and focus. So it works. It's exciting. Cognition is something that's really important to all of us living with MS. So these 2 trials are really exciting because they show that it works. We're showing that we're increasing brain volume. We're helping to combat some of that damage in MS and that we can do it remotely. So even those who don't have access to a specialist in their area could see the benefit of these things soon. We also found that cognitive behavioral therapy, which is psychiatric therapy, either alone or with medication, does effectively reduce fatigue. And again, CBT is a very accessible therapy. And what it does is it sort of like turns down the volume of the impact of the symptoms. So we know that we deal with things. We deal with fatigue, we deal with pain, we deal with insomnia, but actually retraining how our brain reacts to those symptoms and, as I like to say, turn down the volume of the effect actually does significantly improve your life and your quality of life. So there's a trial now that showed it was beneficial either with or without additional medications. And there's actually a large clinical trial called CAFE-MS that is going to start, it has started recruiting, which is another online option for fatigue. And that's happening through iConquer-MS, which I'm going to give you the link to at the end of this presentation. And so the last thing I'm going to talk to before kicking it off to Jenny, so exercise benefits. So there was another big study called STEP for MS, and that showed improved mobility and quality of life for those with walking impairments. And this was home-based, again, online. And it's great. It's just a great option because not everybody has the option to go in person to these things. So we also found that resistance training, especially for middle-aged MS patients, improves strength and physical function. This is really important because the average MS patient is over the age of 55. So really emphasize that resistance training helps us function better as we age with MS. Also found that regular exercise may actually stabilize the blood-brain barrier and help reduce the inflammation, offering long-term neuroprotection. So there's actually something biologically happening beneficially with exercise, which is great. So now I'm going to turn it over to Jenny, and she's going to take it from here.
Great. All right. Hello, everybody. So thanks, Stephanie, for the really interesting updates on the other topics. And I'm going to shift gear to talk about diet-related research because I understand that many of you had questions about diet in MS, and there has been some really interesting studies that came out to kind of help guide our recommendations as neurologists to patients. So first of all, I'm going to talk about the gut. You may have heard a lot about the gut-brain connection, and what is that? So basically, there's a very complicated communication between the gut, the immune system, and the central nervous system. And the gut, a fun fact, is actually the largest immune organ in the human body. And the gut microbiome is pretty much an entire ecosystem that lives in the gut that comprises of trillions of bacteria, fungi, and viruses that actually help us defend against diseases. And they also help develop our body's immune response and are important for, various type of nutrient absorption. So when there are disruptions in the gut microbiome, that can lead to abnormal responses in our immune system, and then that later can, contribute to neurodegenerative diseases and other autoimmune diseases. So we know the gut is important, even in the neurologic world. And there are several things that can affect the gut microbiome. So there are some studies that have shown that diets high in fat and sugar can increase something called the gut leakiness. Basically, it allows the gut to, it causes the gut to allow various things to permeate through, a supposedly very tight barrier. So things get into our, immune system, get into our bloodstream that are not supposed to get there. And that influences our immune health. And in contrast, if you have a diet high in fiber, that have been shown to be neuroprotective. And in the MS world, there has been a lot of studies that demonstrated that disease-modifying therapy, the various, immune therapy that you're on can actually alter the gut microbiome composition. So we know that by treating, ourselves with, various immune modulating agents, that can affect the gut health. And there's been a couple other studies that show that by transplanting fecal matter from MS patients into mice, that can lead to the development of a condition in mice that's very similar to MS in human. So very interesting study. And there's been a couple, case reports of MS patients receiving, fecal matter from healthy patients without MS and have, been proven to have some positive results. But, there's larger clinical trials that have been proposed to look at fecal transplantation in MS, and there has also been trials looking at whether taking a probiotic supplement can help maybe suppress our immune system and shift us towards a more balanced immune health. So there's a lot of different studies that are ongoing. There's been a lot, really a lot of buzz around the gut health. So I really wanted to highlight that in today's talk. Okay, move on to the next slide. And then diet. I'm going to talk about diet in detail. You may have also seen plenty of buzz around Mediterranean style diet in the media. So what is the Mediterranean style diet? It's a way of eating that emphasizes basically on minimally processed food. It's based on the traditional eating habits of people who lived in the country around the Mediterranean Sea. So, the people from Southern Italy, people from Greece. So the Mediterranean style diet was to mimic their eating habits of the people from that region. And then this is a very simple schematic that shows what your plate should look like if you're kind of trying to adhere to a Mediterranean style diet. So 50% of your plate should be fresh fruits, vegetables, colorful, minimally processed, organic compounds. And then 25% of your plate should be protein, mostly from plant, because it is a plant-based diet. So, you can think about things like beans and tofu. The Mediterranean style diet also allows you to eat meat. So fish is also encouraged. Poultry is encouraged, but it should be very little or minimal or even no red meat, because red meat we know contributes to inflammation. And then the other 25% of your plate should be whole grains, carbs, but whole grains. And then also you can include things like healthy fat from extra virgin olive oil, again, from fish with all the omega-3 fatty acids, and avocados. And you notice that there's no sweets on this plate, because the Mediterranean style diet basically dictates that we should eat minimal sweets, only one per week, if at all. Okay, next slide. So specifically in MS, there's been some randomized controlled trials that were published demonstrating that MS patients, compared to MS patients who were prescribed a Mediterranean style diet intervention compared to MS patients who didn't, those who received Mediterranean diet intervention did better in terms of fatigue and also the impact of their MS symptoms on their lifestyles, and also had a better disability score. That's compared to the group that did not get the Mediterranean style diet intervention. And also there's a couple other diets that have been studied in the neurological world that are kind of similar to the Mediterranean style diet. You may have heard about the DASH diet, which was originally developed for patients with, heart disease and hypertension. And you can see how it's very similar to the Mediterranean style diet, that there is still an emphasis on, fresh fruits and vegetables, legumes, nuts, minimally processed food, and very little red meat again, and very little sweets. And then also there's the MIND diet, which was, developed for the aging brain. And basically the MIND diet is just a combination of Mediterranean style diet and the DASH diet. And you can see, so it's all very similar concepts. And then the only difference in the MIND diet is that they restrict the consumption of cheese, butter, and fast food, basically saying you cannot have any of this at all, rather than minimal consumption. So, okay, so moving on to the next slide. So there's a lot of diet-related research recently published. So there's a study that looked at thousands of older adults in the U.S. using a registry-based study. So these are, patient data that were already there. So the researchers looked into the registry and looked at these thousands of older adults, and looked at those who had a high adherence to one of the three diets: the Mediterranean diet, the DASH diet, or the MIND diet. And they found that people in this registry who had a high adherence to one of these diets did better in terms of their cognitive scores at baseline. So they did better on the cognitive testing. And then they looked at data a little bit closer. Those who had high adherence to the Mediterranean style and the DASH diet had a slower decline in terms of their cognition over the course of 6 years. So this type of diet can also have sustained effects in terms of preserving your cognitive health. And that's in people without, in the general public without, some may have MS, some may not. And then there was another study, a very large study, looking at over 5,000 adult patients with MS at a single center, that looked at how those who had high adherence to the Mediterranean style diet, they had lower risk for disability later on. And they also had a lower risk of patient-reported outcomes in things such as depression. Basically adhering to a Mediterranean style diet help with their mood as well. Next slide. So looking at, this is basically a summary that kind of talks about how everything that we eat can impact our body. So I hope that over the last couple of slides, I have emphasized the importance of diet to, to bring health, because we obtain everything that our body needs through what we eat. So things like vitamins, proteins, and other bioactive compounds, they really play an important role in our brain and immune health. So we try to stay away from ultra processed food, because there's been studies that show that the ultra processed food can affect the gut microbiome, causing imbalance in the gut microbiome, and which leads to poor immune health. So really, to combat against the aging brain and to combat against the inflammatory brain in the case of MS, we really need to watch what we eat and practice more intentional eating habits. And as demonstrated by the last couple of slides on the research, that show Mediterranean style diet is the way to go. So that's what I recommend to my patients in my clinic as well. All right, next slide. Okay, so then if some of you asked about some of the more less well-studied types of diets in MS, so these are all very, very small trials. So compared to the trials looking at, thousands of patients, these are very small. You're looking at double-digit numbers. So intermittent fasting, there's been some studies looking at, intermittent fasting, how if we restrict intake of food for certain time periods, we can possibly improve patient-reported outcomes and also improve disability. And the studies that were completed showed that MS patients who did go on an intermittent fasting, it was well tolerated, no significant adverse events, and there's some potential in improving, brain volume and reducing the neuroinflammation in the brain. Ketogenic diet, which is a diet that's high in fat and low in carb. And basically, if you stick to a ketogenic diet, it forces your body to burn fat instead of carb for energy. And this is originally used in, in the epilepsy world, in, people with seizures, and, they go on the ketogenic diet that can help reduce their seizure burden. But there's some studies that show that in MS that can also improve disability and the quality of life and reduce fatigue as well, basically improving people's energy. Again, these are all very small studies. The Paleolithic diet is a diet that basically was invented to imitate the diet of our ancestors, to basically eat what our ancestors were eating, like, hundreds of thousands of years ago. It's a diet emphasis on whole foods, so nothing processed. Again, nothing processed. Basically whole fruits, veggies, lean meat, high fiber, fish, eggs, nuts, and seeds, anything that you can imagine, what cavemen used to eat back in the days. And then there's some small study that demonstrated that sticking to a Paleolithic diet also helped reduce fatigue and improve other markers of mental and physical quality of life, and also increase your exercise capacity in MS patients. And lastly, low-fat diet. Basically, there's some study that demonstrated that patients' fatigue score improved. So a lot of these diets, you can see similarities in that basically minimally processed food, minimal processed food, a lot of the more organic, ingredients can help improve some of the symptoms, and also may have biological effects in the way MS progresses. Okay, next slide. And vitamin D, many of you are probably taking vitamin D, and there has been a lot of studies that demonstrated that there's a connection between vitamin D and MS. Vitamin D is an essential organic compound that we obtain from our diet. So this is nothing that our body generates. We have to either eat it, get exposed to sunlight to make vitamin D, or take supplementation. So it has a lot of role in bone health, but on top of that, it has a big role in immune health as well. And food rich in vitamin D include, like fatty fish, eggs, and mushrooms. But I mean, a lot of you are probably taking additional supplements on top of that. So in MS, recently there was a study called Delay MS study. You can look it up on Google. It was a trial that basically looked at patients with clinically isolated syndrome. So patients who are not yet having the full-blown MS, but have maybe one clinical event that put them at risk for future MS. So they looked at these patients, 316 patients to be exact, randomized half of the group to take high-dose oral vitamin D, which is 100,000 units every 2 weeks, and the other group was randomized to take placebo, meaning like a compound that did not contain vitamin D. And next. And you can see that the group that took this high dose vitamin D had a significant imaging basically outcomes. They had a significant reduction in their MRI activity in terms of fewer enlarging lesions, so lesions that fewer lesions that were growing, and then fewer contrast enhancing lesions, so that in turn kind of translates to fewer inflammation. They did not have any clinical effects in that patients who who took vitamin D versus patients who did not. There's no difference in terms of who had which group had fewer episodes of relapses, but there's a lot of positive imaging effects. So this kind of helps us basically confirm what we have already been practicing, which is recommending high dose vitamin D in patients. And then another result from this study was showing that this high dose vitamin D was well tolerated. Patient did not have any significant adverse events. So this is something to be to watch out for in the future in terms of the full results. But I think vitamin D definitely has a role in MS. So that's something that especially if you're low in vitamin D, definitely talk to your healthcare provider about being on the supplement. Okay, next. So this is more of a summary slide that talks basically on all the things that I talked about, how our brain health is really determined by our lifestyle, by our environment, and also by medical interventions. You can see on the bottom of the screen how stable gut function is really dependent on having a healthy barrier, which means having a very healthy and balanced gut microbiome composition. And this in turn will help protect the connection between gut, blood, and brain. And you can really improve your gut health by, lifestyle interventions such as, having a routine exercise regimen, making the dietary changes as we have discussed earlier, things like having adequate sleep and reducing stress, having a good stress mitigating techniques that can really help impact our gut health. And also from an environmental side, you can see how recognizing and reducing our toxin exposure can also impact our gut health, and on top of that our immune health. And then potential medical interventions such as whether it's fecal transplant or antibiotics, probiotics, those are the things that are still being investigated, but they can potentially also help improve our gut health and brain health. Okay. Next slide, shifting gears to biomarkers. You may have seen your healthcare provider order this specific test in the past year. So this is a test called neurofilament light chain. What it is that so just going to the left side of the slide, you can see what depicts here is a neuron, and the neuron has the axon that extends to different places. So that's how our nerves transmit signal from one another. And so the axon of the neuron is made of thousands of neurofilaments. So you can think of these kind of like a building block of a nerve. So neurofilament light chain, moving to the next slide. Yes, there. So that is, oh, sorry, going back. There you go. Okay, so the neurofilament light chain is a part of the building block. It's just one of the building blocks. And that's something that we can actually measure. So it's a structural protein. And so you can imagine when you have an MS attack, or essentially anything that damages your nerves, you're going to have these building blocks break down. They're going to float around in the spinal fluid that then get leaked out into the blood. So you can measure the level of neurofilament light chain in your blood as a surrogate for neuroaxonal damage. So the level is going to be high when you have something that damages your nerves, and then the level is going to be low when you don't have any damages going on. So it's not specific for MS, like I said, because you can imagine if you have concussion, if you have a stroke, something that damages your nerves, you're going to have elevated levels of neurofilament light chain. But specifically in MS, we know that they can be elevated when you are in the middle of a relapse, when you have new enhancing lesions on the MRI, indicating that there's inflammatory damage. Neurofilament light chain can be elevated. So we can't really use this to diagnose MS because it's just not specific enough for MS, but we can use it to follow along to see what your nerve health essentially is like. So the levels can decrease with treatment. So if somebody with MS having a relapse and you measure the neurofilament light chain is going to be high, and after they go on treatment, for example, one of the disease modifying therapies, and then you measure the neurofilament light chain a couple months later, it's going to be low. So we know that the neurofilament light chain is a level that we can follow to really determine how much damage there is to the neurons. Okay, next. And this is another biomarker called the gliofibrillary acid protein, or GFAP. This is less common just because it's newer. There's not a lot of data as opposed to neurofilament light chain related research in MS. This is a structural protein in astrocytes. So you can see the figure on the right. The purple, the purple cell is the astrocyte that lives in your brain. It's a structural protein. It helps to support the various neurons to keep things in place, and it has, obviously participates in the immune health. So, the gliofibrillary acid protein is inside these astrocytes. So you can imagine when you have an astrocyte breakdown, the cell, for example, dies and release all the GFAP particles inside the cerebral spinal fluid and then leaks out into the blood. This is something that we can measure in the blood as a surrogate for astrocytic damage, so damage to the astrocytes. So, so it's not, again, not specific for MS, again, because, if you have a stroke or concussion, this level can also be elevated. But in specific in MS, though, we can measure the level to follow the disease, the disease progression. We know that high GFAP levels can help predict who is going to have more likelihood of having their disability progression. So it may be a good marker for progressive MS, but right now we just don't have enough data to really support the widespread use of this in the clinical world. But you may see more and more research coming out about this biomarker as well. Okay, next slide. Oh yeah, sorry, I forgot the arrow. Okay, next slide. I think I'm gonna shift it back to Stephanie about underrepresented research populations.
Yes, and you can take over answering some of these great questions.
Great.
Yeah, somebody just asked, is NFL measured by MRI? And the answer to that is that it's a CSF biomarker in the spinal fluid, but also we can measure it in blood now too. So yes, so shifting the focus a little bit to underrepresented research populations, and someone brought this up in the chat. Why do we only do research on people who are under 55? And the problem with research is it historically leaves out most of the population, right? So we generally are looking at people who are relatively young, don't have anything else wrong with them, so they're relatively healthy, aside from the fact that they have MS. Over 70% of MS research is done on Caucasian females. So we have a lot of unanswered questions about males, about African American and Black, Hispanic and Latino patients. So there's a big effort to increase the diversity in trials, but then also to go back and look at how treatments that have already been FDA approved, whether they work equally well in these populations. So one such study was CHIMES, and this was done by Genentech to look at the efficacy and safety of Ocrevus in these underrepresented ethnic populations who had relapsing MS. So we know that these two populations tend to have more severe disease than Caucasian patients. So that left the question in our minds whether it's that they're not responding as well to therapy. And this study indicated that at 48 weeks, 50% achieved no evidence of disease activity, which actually aligns with the outcomes observed in white populations. So this shows that Ocrevus absolutely is effective. Somebody pointed out Asian populations. Yes, they are a very small subset of the Asian of the MS population that gets overlooked way too often. And so the other interesting thing is that ancestry-specific genetic variants were found this year. So a large-scale study actually identified novel genetic risk loci that are associated with MS in African American and Hispanic populations. So this is a good progress at finding out why some populations are more at risk for MS than others. And so if you don't already know, Caucasian and African Americans are the most highly susceptible to MS, whereas Hispanic and Asian populations are less susceptible. Next slide, please. Okay, so all this great research could not have happened without people like me and you actually participating in these studies. So why participate in MS research? Well, everything helps move us forward and helps us bring better treatments and improve quality of life. It's not just drug trials. I have participated in, at least 10 more trials. I have tried exercise, I've tried cognitive behavioral therapy, I've tried cognitive interventions, diet, you name it. I go to the NIH once a year and I have my brain scanned on some very fancy machines. So it's a passion of mine to move forward MS in any way possible. And I've learned a lot about my body and about my MS by participating in those trials. So it's a two-way street. It really helps both parties. So how you can get involved, there's a organization called I Conquer MS, and you can actually share your health data, you participate in surveys, you propose research topics. So you can actually, they have these initiatives where you can ask the community, like, what diet is going to help my MS? And then other members of the community can add on to that idea, can comment, and then we can match them up with researchers who are interested in the topic. So this group is really driving research from the patient up, which is really great. You can sign up at iconquerms.org. And then we just started, this is the organization that I work for, full disclosure. We just started a very large clinical trial for an online-based therapy for fatigue. So we'd love for you to come join us for that if you experience fatigue. You can also find ongoing MS trials using platforms like the National MS Society's research portal and clinicaltrials.gov. So if you go to clinicaltrials.gov and you type in your MS center or centers near you, and use the keyword multiple sclerosis, you can actually see a list of every trial. It will tell you if it has ended, if it's ongoing, if it's recruiting, if it stopped recruiting, if it has results, and give you links. So it's a really great resource. It's maybe not like the most intuitive platform to use, but everything, every trial that goes on has to be registered on clinicaltrials.gov. So if it exists, you can find it there. Other resources, I've dropped a lot of things in the chat already. So a lot of you have been talking about sleep, about diet, about cognitive behavioral therapy. If you name it, we've probably done a webinar on it. So we have archives on our website at Can Do MS where you can explore. All of these things I have and will talk about for an hour. They're such important topics that just we can't get to everything in all one thing. But the other easy thing to do is ask your healthcare team. And I say team, not just your neurologist, because if you have a physical therapist, they might be doing research. Or if you have a mental health professional, they might be doing research. Ask them about research opportunities. So again, we have linked all of these things in the chat. The slides that you will get after this will have these clickable links so you can go back to them. Great. So now we open it up.
Yes, great. Thank you both. So much good information, and we have a lot of questions. I do want to just drop a quick reminder that we do truly appreciate if you complete the survey that will pop up on your screen at the conclusion of the webinar. But first, let's get to some of your questions that were submitted during the presentation.
I'm reading through. So I did answer. Okay. I did answer in the chat, but I think when I answer the Q&A, it doesn't go to everybody. So there's been a lot of questions about progressive MS research. So the two new medication classes, the BTKs and the CAR-T, those are all involving progressive MS patients, both secondary progressive and primary progressive MS. And like I said, that one medication, tolebrutinib, was shown to slow progression in secondary progressive MS. So I think, in my opinion, and Jenny can weigh in, that's probably the next frontier of MS that's coming soon. There's still ongoing research in CAR-T and stem cell transplants. And then there's actually an international progressive MS alliance that is so inspiring. I've had the honor of going to some of these meetings around the world, but it's scientists and researchers and organizations devoted to finding answers for primary progressive MS patients. So if you are living with PPMS here tonight and you feel like all we do is talk about RRMS and there's nothing out there for you, I want to assure you that there's a massive scientific community that are solely focused and pouring money and resources and really driven. So there's a ton of exciting work that's going on. I'll drop the link to their website, because if you haven't heard about them, you really should. They're really wonderful.
Yeah, no, the progressive, if you, I guess depending on which center you're at, sometimes your center may be involved in progressive MS research. So for example, we're involved in a couple that enrolls, predominantly progressive MS patients. So definitely check with your, healthcare team about if they're involved in any research that you may qualify for as a progressive MS patient.
Stephanie, this question came up early in the Q&A. Can you define biosimilar?
Yes, I actually also linked. I also linked the biosimilar, but since I'm going to be talking, maybe if you could go to the archives and find the biosimilar. So we have done an entire podcast, an entire webinar on what a biosimilar is, and it's not a generic, it's different. And like I said, in cancer, this is something that's very common. So this is, Jenny, do you remember the name of the Tysabri biosimilar? I'm trying to.
Iruko.
Yes, yes.
I remember it sounding like a Pokemon when I first.
I know it does. It does sound. So they're really similar to the original medication, but not directly identical. So they're made from the same types of sources, like a bacteria or a yeast or an animal cell, and they are shown to be as safe and as effective as the reference medication. So they're approved by the FDA to the same standards of pharmaceutical quality and safety and efficacy. They're used the same way, the same dose. So if you get Tysabri, you're still going to get the biosimilar at the once a month IV as the reference medication. But the goal is that they would come out at a lower price tag.
I found that webinar and I dropped it in the chat.
Thank you. Yes, I did an entire podcast. It's really great. It breaks it down really well. So if you get a chance to listen to the biosimilar podcast, that's a great source of information.
Yeah. And there was a question from Patty, I believe, talking about when secondary progressive MS is identified after experiencing relapsing remitting MS. So to basically to be identified as a secondary progressive MS patient, you must have initially a relapsing remitting course, but then if afterwards, if what you're experiencing is predominantly progression, means between the relapses, in the absence of any relapses, you're still getting worse, month by month, year by year, without suffering relapses, then you would be probably in that secondary progressive category. And you have to really distinguish it from having, deficits that kind of persist after relapse, because that's relapse associated worsening, which is a little bit different than actual the progression in between the relapses. So there's two disease processes going on. And basically, if you're getting worse and you're not, without having a relapse, without having new lesions on the MRI, then you might be in that secondary progressive MS space.
And
Yeah.
Jenny, can you talk about a little bit more about vitamin D? Lots of questions about dosing and toxicity.
Yeah. I mean, I see the various responses regarding dosing, because there's really no standard dosing. So that study, the delay MS study that looked at 100,000 units every 2 weeks, which is kind of similar to what we prescribe here, is 50,000 units every week for patients with low vitamin D. But once you get into the range of, the target blood range that we target for, it's also very variable. There's no standardized, like a golden blood level that we need to aim for. But usually we say higher than what's quote unquote normal. So basically, if you look at, the various labs, 30 nanogram per microliter is considered normal, but usually we tell MS patients to aim for higher in their blood work when they check for vitamin D level. So in my clinic, I usually tell patients between 40 and 80 when we check your blood. That's the range we should aim for. But I have seen people trying to go for 70 to 80, like somebody mentioned. Somebody say even 80 to 100. So basically, I think in the higher range, but without being in the toxic range, is reasonable, because once you become in the toxic range, you're at risk for kidney stones, and then people may have experienced nausea, just like side effects with supplementation dose that's just too much. But that's why when you are started on the vitamin D supplement, especially a prescription one with a higher dose, make sure you're checking your levels every like maybe 6 months or so, to make sure you're not in that toxic range.
Thank you.
Yeah.
I'm seeing a lot of medical marijuana questions, which is always a hot topic. So let's talk about it. Marijuana has been shown to be effective for pain, for spasticity, so to manage the symptoms of MS. So I have two important points on that. It is widely accepted, it's prescribed, but please do not smoke it. Do not inhale it into your lungs. Nobody needs that. It is not good for your body. So if you're gonna have it, eat it. So please, you heard it here. No smoking anything if you have MS. The other thing to consider with medical marijuana or marijuana products in general is that just like with anything else that can impair you, if you have cognitive issues, if you have balance issues, it might not be the thing for you. Jenny, do you have any other wisdom to impart?
No, I agree with the non-smoking part because yes, smoking anything to the lungs is not good. But I have seen patients using, medical marijuana when it's prescribed by a licensed, dispensary that's regulated. The product contains truly just that without being laced with anything else. Patients have used it for sleep, for mood, for spasticity. So I have seen patients reporting positive effects from using it. But another thing to be mindful of that again, it is another compound. You can think of it like a drug, so it does have side effects, and so it's not like a magical pill. So taking medical marijuana, you can't be expected to experience side effects. For sometimes if you take too high of a dose, you can have drowsiness, you can have impaired attention. It can also cause issues in your appetite and your mood. So definitely when you're using medical marijuana, make sure you're getting it from a licensed dispensary, that so it's being regulated and you can control the dosing and everything to adjust to target your symptoms.
Yeah.
Yeah.
Yes, and it can cause GI issues too. So if
Yes.
if bowel dysfunction is an issue for you, again, you might want to steer clear of it. But there are also like creams, hemp lotion, things like that that really do help with like restless leg, with spasticity. So I at night use hemps. It's no THC or anything, and that helps calm down my spasticity and my restless legs at night. It's a wonderful lotion. I've recommended it on these webinars before, and every time I recommend it, I get so many messages like I tried it and it really helped. And you can just buy it at the grocery store. So important. So always an important and popular question. What about vaping? Vaping, same thing. Don't put anything in your lungs. That's my takeaway for today. I'll type the name of the lotion in the chat because people are asking.
Stephanie, you might have addressed this in the chat or answered some questions, but do you want to talk about muscle spasms?
Sure. Yes, we can talk about muscle spasms. So I'm currently on this call with a hot pad wrapped around my torso because for me, cold season is MS hug season. So there's a number of things we can do for spasticity. There is baclofen, there's muscle relaxers, there's medications that can calm your nerves down. Usually those are like anti-seizure medicines or depressants that we use. So heat, stretching, exercise really is the key. And stretching can help a lot too. If that doesn't work, we can escalate. We can inject Botox. You can have a baclofen pump actually put in. There's some interesting research on using basically what's pneumatic boots or like air boots. And they've been used for like peripheral vascular disease, and then somebody discovered it actually really helps MS spasticity. So that was a topic at this conference I went to in the fall, and there are devices that are now being tested for MS. And Jenny, I'd love to hear if there's anything else.
Yeah, no, I think spasticity definitely it's a difficult symptom to treat because a lot of times, taking medication may not be the answer for patients who cannot tolerate the muscle relaxers, or just that who are experiencing a lot of the side effects, or maybe they maxed out are still having spasticity. I do want to mention the ability to definitely in centers that do have PM&R departments, I send some patients there for consideration of things like Botox too. And then they also have a physical therapist who can do things like dry needling. There's practitioners who do acupuncture for things to help with spasticity. So definitely not just all muscle relaxers. There's a lot of things that you can do that are non-medication related that can help with spasticity. Yeah. And magnesium, I don't know if we discussed that yet. Magnesium can help with spasticity too, without causing a lot of the drowsiness side effects you might see with muscle relaxers.
Yeah. People are asking, I've typed the name in the chat a few times, but here's an Amazon link. I just dropped that in. Oh, Jenny, there's a great question for you. Somebody asked, what is smoldering MS? That's definitely a hot topic.
Yeah, it's definitely a hot topic, and it's a term that's became more, I guess, popular in the last couple of years, basically to capture the underlying pathophysiology of MS, because we know that MS is not just all about relapses, not just about having lesions, because you see patients who had MS for for years, who have pretty stable MRI. Every single MRI they do is pretty stable, and then they're on disease modifying therapy, but they're getting worse in terms of fatigue, more cognitive issues, maybe just more, exercise intolerant. They used to be able to run 5 miles. Now they can, barely walk a mile, while everything else is just looking stable. And the term smoldering MS is basically, invented to capture that slow inflammation that does happen in quote unquote normal appearing MRIs. You don't see any contrast enhancement when you get the MRI, but we know there's a low level of inflammation that's just going on at all times that also impairs impairs neural repair. When you have a lesion, your brain sends cells there to repair, but having that smoldering inflammation underneath can also impair your ability to get back after each relapse. So there's a term that's been invented basically to capture all of the things that we know that's not just relapsing remitting MS causing problems. And there's a lot of research geared towards trying to understand smoldering aspect of MS and how can we develop therapeutics to treat that.
Jenny, a lot of questions coming through about B12. Can you address B12?
Yeah,
Vitamin B12
I mean, it's one of the essential, again, just similar to vitamin D, is one of the essential organic compounds that we get through diet. But B12, if you're eating like a pretty balanced diet, then your B12 level should be in the normal range. So for patients who have low B12, when I tested, are usually patients who may have not have not been eating that well. Maybe they have some GI issues, and have trouble with absorption. And there are people with, stomach issues that have trouble absorbing B12. So if you're eating a balanced diet, then your B12 should be fine. But if you're not eating a balanced diet, or maybe if you have some issues in your, in your gut absorption system, low B12 can lead to things like neuropathy, fatigue, cognitive issues. So if you check a B12, usually, as on the neurology side, we tend to again target for a higher range in the blood. So if your level is like below 500, then usually we try to give supplements either orally or through intramuscular or subcutaneous injections to get your B12 level higher, because that can improve some of the symptoms in certain cases. So, but I always say, if you don't have already a known B12 deficiency, don't just go ahead and go to the market and buy a bunch of B12, because then it's a water soluble vitamin, which means if you have too much B12, then your kidney just kind of filters it. You have, B12, very B12 rich urine. So only supplement it if you actually have low B12.
And everybody is in the chat asking more information about magnesium. So as with every other vitamin, just look for ones that are labeled and trustworthy. So usually like I recommend like a Nature Made or something that's a little bit, you're not just buying it off Amazon. And the thing with magnesium is it is a little bit of a laxative, which for many of us with MS is a good thing because a lot of us are constipated. But therefore, I recommend like starting low and increasing slowly. Is that generally how you take it, Jenny? I usually do like 1 and then go up to 2 if your GI system's taking it.
You're starting like 400 milligrams of either magnesium, glycinate. It's probably my favorite form because it doesn't cause as much GI side effects for patients who are not looking for that. But then if you do have constipation, then magnesium citrate is great for constipation because it can help loosen up the stool. But magnesium glycinate, otherwise I would just, or magnesium citrate or magnesium oxide. Usually I say start at 400 milligram, take it at bedtime because it can help with sleep. And if your body tolerates it good, so then you can increase it to 400 milligrams twice a day or 800 milligrams at bedtime. So these are the doses that you can consider. Yeah.
I saw a question. Oh, go ahead.
I was just going to say, I'm seeing again a theme of like older with maybe some cognitive issues. Is there anything I can do? And so I just want to reiterate again, it's in that slide that I presented, but we did find resistance training increasing the brain volume in middle-aged MS patients. So yes, there's absolutely something you can do. Exercise, and then cognitive rehabilitation. So we've showed in that study that cognitive rehabilitation can be offered online. Because cog rehab is great, but it's not widely available. But ask your neurologist if there's somebody in your area that could administer cognitive rehabilitation, and if not, turn to online. And then I see stem cell therapy. Stem cell therapy is very exciting and very promising, and there's a lot of ongoing research. I can link since we only have like a minute. Jenny, if you have like a 1 to 2 sentence, and I'll drop the MS Society website with stem cell therapy updates on it.
Yeah, no, stem cell therapy, there's different types of stem cells. So when you look into stem cell, there's, the stem cell that you get from sorry, I have a little cough. Stem cell you get from your, from aspirate from the bone marrow, and then that becomes stem cells that participate in the immune function. Or you can have mesenchymal stem cells, which usually aspirated from like fatty tissue. So there's different types of stem cells. So I would just warn everybody that right now that there's a lot of stem cell clinics floating around. So there's stem cells not FDA approved for MS treatment yet, but there's definitely a lot of really promising research looking at stem cell transplantation for people with really highly active MS or people with progressive MS who are getting different types of stem cells. So don't just put all your money into some random stem cell clinic in the mall, or go to Mexico and get stem cell, because there's different types of stem cells. And there's also usually what we call a conditioning regimen, meaning that you have to undergo some form of chemotherapy to really condition your body to be able to receive stem cells. So if you're just going to some random clinic getting IV infusion or something, that's probably not the real stem cells. So basically, if your doctor thinks it's appropriate for you to get stem cell therapy for your MS, usually it's at a tertiary academic center that does actually formalize stem cell trials and conditions.
Well, thank you. That was a lot to pack into 1 hour, and I just wanted to jump back in here, share some more slides about staying connected with us, because this webinar might be over, but we hope you'll stay connected. So follow us on social media, and there you can learn all about our programs, resources, and MS News. You can also register for our monthly e-news series by visiting our website.
Thank you guys for coming.
Yeah, thank you. Join us on January 8th for the next webinar Wednesday. The topic will be how to turn wellness goals into daily habits. So very appropriate for the new year. Just quick housekeeping note, if you are already registered for the 2024 webinar series, your registration will automatically be carried over to 2025. So you do not need to re-register for the new year. Just one more time, want to thank our sponsors. Definitely want to thank our speakers as well, and all of you for being here. Thank you very much for taking the time to spend this hour with us, and please take the survey that will pop up on your screen in just a moment, and have a great night. Thank you.
Thank you. Happy holidays.
Bye.